Welcome back to the EIU podcast series on what do young urologists need to know. This is segment 2, where we discuss the balance of life of young urologists. In this first episode, we are joined by Michiel Sedelaar, oncological urologist and head of the department in Radboud University Medical Center in Nijmegen, the Netherlands. Also Thomas Taylor, urologist and urologist at University Hospital Ghent in Belgium. Together, they will discuss work-well-being balance and is it possible? Join us as we embark on this informative journey.
Hello, good morning, afternoon, or evening to our listeners, and welcome to the session of EU Education Online. Today we will be talking about the work-life balance in our lives of urologists, and I'm very happy to be here together with Dr. Michiel Sedelaar. I'm Thomas Taylor. I'm a urologist and endourologist in Belgium, working in a university hospital of Ghent. And I will be talking about this topic with Dr. Sedelaar. Dr. Sedelaar, would you please give us a short introduction about yourself?
Sure, thank you, Thomas. My name is Michiel Sedelaar. I'm a urologist in Nijmegen, the Netherlands. I'm chair of the department, and my field of topic is mostly oncology and prostate cancer.
Okay, that's great. Thank you so much. So we are here tonight to talk about work-life balance. And first of all, I would like to ask you what you understand by work-life balance, because that, in essence, is what we are discussing today. And in my opinion, this can be very personal, as the needs are different for all of us. The tolerance and resilience to one's workload may be different as well, as the time needed to achieve a certain goal or deal with a certain workload. And some people are more efficient than others. And next to that, the time needed to relax, detach, and distress may also be different. Some people can detach as soon as they get home from work, and some people really take home mentally their work, and they can never detach, regardless how much time they spend on their bike, in the gym, on holiday, or whatever. So how do you feel, and how do you think that we should see work-life balance in general?
Well, I think that you summarized the work-life balance for me quite well, because work-life balance, it's your private life with your personal life, with your professional life. And all doctors are different. All doctors have different needs. But at least let's say in a general point of view, what I see in a work-life balance is that you are still a good human person, that you are a family person, and that you are a professional person, and try to be the best in all those kind of categories. And if you do that by being at work much more than you should, then that's a personal decision, right? We just talked about it, that you're waiting for a emergency OR while we are recording this at 7:15. That's because you love your work. But it's also mean that you are probably seeing your family a little bit less than you would like to, and trying to find the balance in those kind of categories is for me mandatory in when we discuss work-life balance.
Yeah, thanks. Thank you so much. I think you got it spot on there. It is a very personal thing, and it's a personal decision on how to find that balance and how to deal with that. I was thinking about this subject for the past few weeks, and I realized that work-life balance is different in the different phases of our lives as urologists, in which we are challenged with finding this balance between work and life, and that the balance will be different in all of those, because we start as medical students, and then we go on to be residents. And then we have our early careers where we have to build our clinical practice, as well as working on our scientific output, building a name for ourselves, see that we are being seen. And then this leads into the rest of our careers, where we're already more or less established. And not only are there different phases in our lives, there is also distinct differences between an academic career and a non-academic career as well. But maybe for this topic, let's focus on residency and early career, because I think those are probably most difficult to find a balance in. And as a resident, you need to get a lot of exposure. Your goal is to learn as much as possible in the short amount of time that you get. And the field of urology has evolved that much, in my opinion, that it is no longer possible to be proficient in every aspect of the job in the 6 years in Belgium that you get as a resident in training. Together with that comes reduced working hours since a few decades in both Europe and North America. So we have reduced working hours, a more evolved field, and an increased workload as well of administrative tasks. And I think all residents probably should have the goal to become the best physician they can be, so they can provide the best level of care possible to their patients in the future. But what do you think are the main threats to a good work-life balance as a resident? How can we find that balance between excelling as residents, doing a good job, learning as much as we can in the time we get, being on call and so on, and still have fulfillment in a personal life as well?
Well, let's say it's a very broad question, and looking at residents, we're also looking at a different generation, and the needs of every generation are a little bit different. And you don't want to put somebody into a box for your typical example of your generation. But let's say on a broader point of view, when I look at my residents, when I look at my generation of residents, they have different needs than you and me. You told me you're early 40s, I'm early 50s, and the residents are early 30s. So there's a, let's say, 10-year difference in age. And when I look at the residents now, they try to do their work as good as they can, but in the limited time they have. And they are not very eager to work the evening hours if it's not necessary. And of course, it is, let's say, on a point of view, not necessary because you're not on call. But from a point of view, you said that the exposure to pathologies and exposure to surgeries are less because we have restrictions in working hours, which is good, of course, because we have to also make sure that you're not overworking yourself. But I see that they are very eager to go to their personal life. And when I was a resident, and I'm old school resident, let's say, we had a different point of view, and you just work the hours needed to be worked. And I'm not judging the current residents. I'm just stating that there is a difference in how you look at your work, how you look at a professional career. And you talked about non-academic and academic. That also makes a difference. So if a resident is very eager into doing surgery, residence research, or that kind of thing, they tend to go to the academic setting, while they want to have a normal all-round urology job. They go to the non-academic hospitals. And again, not judging, but that's at least in the Netherlands, that's quite a different point of view.
Yeah. Thank you very much for your response there. And I think touched on a very important subject there, and that's the difference in generation. We're both still young. There's a 10-year difference, but as you, I already feel the difference in generation and how younger colleagues identify what they need as a work-life balance, and that factors in or that leads back to what we talked about before, the very personal opinion about work-life balance. And what I question myself is we're probably all right, right? So the younger generation is probably right the way how they do it. We were right when we did it the way we did it. Question I'm leading up to is, how will it be when the younger generation that is now in residency will stream into our work and into our age? Will they keep the same work-life balance that they want to have right now? Or will they identify that they will work or need to work more hours? Because residency needs to prepare you for your eventual job. And sometimes I feel, are we not overprotecting the residents?
Well, that's maybe there's a truth in it, because, like we said, with working hour restriction, on-call restriction, you limit the exposure to pathologies and exposure to surgery. So let's say early 40s, early 50s, when I talk to my older colleagues who were now 60 or maybe just retired, they worked 80 hours or maybe 90 hours a week. We work 50 hours, 60 hours a week. And the young residents work 40 hours a week. And when I tell them old school stories about how we worked, and they look at me and they say, well, who's crazy? you are crazy to work 60 hours a week. So why am I crazy to work only 40 hours? But also in the Netherlands, what you see, whenever they finish their residency and start working as a urologist, hardly any of the young urologists work a full 100% contract. They work maybe 80% contract or even a 70% contract. So 1 day off a week or maybe 1.5 day off a week. And that's also because they find that necessary to find their balance into have a nice, good personal family life. But if I have 6 doctors working 70% or 10 doctors working 70%, I need more and more doctors to fulfill the same kind of job. And that is going to be a very big challenge in the future. And also working 70% makes, again, you less fast in becoming an experienced urologist. So the challenge is one, we want to have a good work-life balance, but two, you need to become the good professional urologist, the doctor you and me want to go to if we need a urologist. And I think there's also a difference in balance.
Yeah, I agree. We see that here in Belgium as well. And actually, we see that not only in the Netherlands and Belgium, but a lot of other countries as well. But there's more and more junior colleagues that prefer not to do a 100% contract, but 80 or 70% or even less. And that's even already allowed in Belgium during residency. You can opt to do a residency instead of 6 years, do it over 8 years or 9 years, and just work less hours a week. It's very interesting and an important topic that you say that, well, we'll need more workforce because with 10 people working 70% instead of 10 people working 100%, we need more doctors to care for our patients. And do you see a bottleneck coming in the near future that we will not have sufficient doctors?
Sure, and it's not just the doctors; it's also the co-workers, the nurses, the anesthesiologists, the anesthesiology, the people at the OR. It's the new way of working, and in that sense, and there's also the disbalance because we have getting an older population. They tend to live longer, being more healthy, also having more medical possibilities to have a longer life. But we're going to have a healthcare workforce which will be strained from the start on, that we will probably don't have the capacity in workforce, in people, to care for all these people. And yeah, I think there's a big challenge there.
Yeah, and that will cause longer waiting lists for patients needing a treatment and so on. Just a few weeks ago, the annual Medscape Burnout Work Stress Report got published. They do this every year, and it's based on a large questionnaire that is distributed worldwide, actually, and they look at all of the disciplines in medicine. And it really demonstrated that the risk of burnout or the identification of risk of burnout is more prevalent in the younger doctors that are challenged with stress and burnout. And the most common responses from these doctors as the underlying causes are the exceeding amount of bureaucratic tasks, the lack of respect from other staff, administrators, and so on, but also the amount of working hours. But what they also identify as a reason for not being satisfied in their job or risking burnout is reduced pay or insufficient remuneration for their job. And I see a contradiction there. If you want to work less hours, you will not be able to do as many acts. You will not be able to provide the same amount of service, and you will probably earn a less amount of money. So are we going towards an imbalance, or people being happier with less salary?
Well, I would hope the last, because if you work an 80% or 70% contract, it makes quite normal sense that you will earn 80% or 70% from a full contract. And that's what we see in the Netherlands a little bit more, that they tend to be satisfied with, let's say, the pay they get, but they restrict themselves completely to what the job intends. They will not perform many tasks outside what the contract says. And whenever you ask people, these are excessive questions, right? It is not for every coworker, but it's just for some of the younger generation. When you ask them a job to do outside their normal working field or working hours, some of them say, "No, I'm not going to do that because it doesn't pay. It does. It's what's in it for me. There's nothing in it for me. I don't have any satisfaction in that, and they just won't do it." I know for sure that you are not trained in that point of view, and I was not trained in that point of view. You just did the job, and I'm again not saying good or bad, but saying that if the young colleague won't do that job, somebody else will have to do the job, right? There are many jobs to do. Restricting yourself into a let's say paper contract, that's what my contract says, and nothing more, will be a challenge for, let's say, for you as a colleague. You don't like those people as a colleague. You want to have people who are able to take over from your job if you have too much to do. So that's also part of the not so good things of the new generation, opting out.
Yeah, the pendulum may be going the other way a little bit. But it sounds and it looks like the younger generation may be better at outlining or protecting their work-life balance, much better than we were. Yeah.
For sure. For sure.
Yeah.
And that's what, when they say to you, Thomas, do you think I'm crazy or you are crazy? You are working at 7:30 waiting for a emergency nephrostomy. So sure, and there's nobody wrong and there's nobody right, but it's work and personal life balance, but it's also balancing the generations in your workforce. You've got your 60, 50, 40, 30, and maybe 20-year-olds who will have to be mingled in a nice kind of mix.
I understand. You said a very important word there just before, and it's satisfaction. There's one quote that I repeat quite often to myself and to my colleagues, and it's from Steve Jobs. And basically, what he says is that you have to be satisfied in your work. You have to love what you do. If you don't love what you do, find something else. Don't settle for a job that you don't really 100% like or that you're not passionate about. So job satisfaction for me is what keeps me going. And I would hope that would be the same for our junior colleagues. But what is your thought on the influence of job satisfaction on work-life balance?
Super important. Super important, because if you don't find your satisfaction, you have the risk of burnout. Because if you don't have the satisfaction, you tend to emphasize all the negatives of your work. You are talking about the negatives of the administration. You're talking about the negatives of the working hours. You're talking about the negatives of the difficult patients or the difficult conversation with patients. If you are satisfied with content of your job, you tend to find those, let's say, obligatory parts of your work less negative. Yes, I'm passionate about my work. And yes, I don't like administration, but I'm like, hey, it's part of the job. And if you don't have the satisfaction, you are in a sort of negative spiral into the chances and challenges of burnout. It's very important.
So what I do and what I think is important is seeking that satisfaction. And what we want to do something that gives us satisfaction. And that can be our clinical work, but it can also be writing a paper or reviewing a paper and feel good about ourselves that we've written a good review, or making slides, giving a talk somewhere. That can also give satisfaction. And it's not only the clinical work. And what I think about that is I think about a few talks that I've heard throughout the years about starting your career as well as maintaining your career and finding work-life balance. And what I identified is that a lot of talks from big names, big professors, quite a lot say the same thing for beginning your career. And they say, always say yes. Somebody asks you something, say yes. Do you want to give a talk? Yes. You want to write a paper with me? Yes. You want to do that emergency case with me? Yes. But interestingly, the same professors also say, how do you keep going? How do you choose what you do? Because From at a certain point, you'll get 10 invites for a paper review per week, and you can't do them all. And then they all say, learn how to say no. And sometimes it sounds contradictory, but it's, again, different phases in our lives. And what's your opinion on this? When do we go from saying yes to saying no?
Yeah, I think that's very important. Let's say making a name for yourself. Sure, you should say a lot of yeses, but protecting your workload, protecting your work-life balance, you also have to say some no's. And I think it's, again, that's more like a personal evolvement. But let's say if you notice that there's no more room for yes, then you definitely should have said no, right? You're always too late in saying no, but you cannot say yes to everything. And maybe it's after 5 years of starting your career, maybe it's after 10 years of your career, but those are, let's say, a little bit of the timetables where most eager, academic, ambitious urologists will have to start saying no, because then, of course, you restrict your point of view, you restrict your tasks, and you become better in those tasks instead of going all the way in the field. When I was a young academic urologist, I was flying everywhere. America, Indonesia, again back to America, Europe, whatever. And I loved it, but it was also very tiring. But it gave me a lot of satisfaction. It gave me a lot of opportunities to let's say be on the podium, but also to get to know a lot of people. And after 5 years, maybe after 10 years, I noticed that I started traveling less and less. And of course, it become even less after COVID. But I'm not looking for all those flights to everywhere anymore. But I used to love it when I was young, and that was also because it was a sort of bonus in your academic life. And now I've done that. Now somebody else can do the traveling, and I will support them everywhere.
Oh, that's very nice. You've just outlined the different phases. It's very interesting. Yeah. In the early career, you fly everywhere, you say yes all the time. And at some point, you identify yourself when it's time to say no. It's probably just slightly a little later than you should have started saying no.
But yeah, of course, it's always later. It's always later. It's always when you notice that, oh, I was so tired of traveling, that you say, why was I tired of traveling? Because you've done it all. You've been everywhere, and you've done your 100 or 150th talk on a podium.
Exactly.
Let's say then there is nothing new to be gained anymore.
So saying no is probably a very important part of protecting that work-life balance, right? And also preventing burnouts. I know that working too many hours or saying yes too often may lead to too much work stress and a lack of job satisfaction as well. Do you think there's a lot of other factors that may lead to burnout or bore out even in every step of our career?
Well, you said in the beginning that being restricted to your residency hours, you are not able to do the broad field of urology. So you will either do, for instance, stones, or you will do oncology, or you do minimal invasive treatments, or you do functional urology. And let's say it also depends on the size of the hospital you work in. But sometimes you work in a smaller hospital with only one field of urology, with not so many emergency cases, so not so many exciting cases. And there's the challenge for bore out, right? It becomes routine. It becomes too easy. There's no satisfaction anymore in the work. And then the burnout or bore out is becoming really a challenge. Also, of course, if you don't find the work-life balance, if you tend to be at work too much, less at home, that is also a big challenge for your burnout. So try to maintain that balance. It's let's say key to have a healthy professional and personal life.
Yeah, I think you're right. And as residents, you're protected for this because you have restricted working hours. What you do with your time outside of those hours, like writing a paper or going on a 4-hour bike ride or however you feel that, that's your own decision. But once you're in your early career and later on, I feel that that protection is gone because it's all you now. And maybe as a resident, you didn't learn how to manage with that responsibility. And what I'm wondering is, do you think that we need to get protected more by our employers, for instance, that may say, okay, now it's time for you to better delineate what you can and cannot do. You need to take all your time off and so on. Do you think there are strategies that can help us in early career to keep our work-life balance?
Yeah, I think that's also a little bit dependent on where you work and which country you work, right? So in the Netherlands, we have our labor forces are in the hospital. Either the nurses or the doctors are very organized, and they have, let's say, collective agreements on work. And that also goes on to until what age are you allowed to be on call? How many hours do you work? Not just for the residents, but also for the doctors. If you were on call yesterday, you are not able to do any hospital patient service. Let's say those are the new rules, right? They just came out last week. And of course, they are very protective for our colleagues, for ourselves. But it's almost impossible to apply all those rules because, again, there are so many patients, there's so much work to do. And if I was on call, let's say I'm Thomas today, I don't see patients tomorrow. While you will have an outpatient of 30 patients, or you have a surgery program of 6 patients. It's good that the rules are to protect us, but how are you going to implement those rules? And that's also that's almost like contradiction. It's almost like contradiction. And maybe other countries have not those collective job rules, and of course, then you just work, right? And the pay in those countries is sometimes also higher because you get paid by every single patient or by every single case, and that's also different in the Netherlands.
Yeah, it's similar in academia here. So, like you said, remuneration is definitely an important part of it. And the Medscape report did identify that as well, that an insufficient, between brackets, an insufficient pay quite often leads to burnout because we work a lot of hours. And if I look at how many hours I work and the salary I get, I'm completely satisfied. But the amount of work that you put in, I can imagine that some people would say, I work so much, I need to make more money. So that can definitely be a difference between different countries. Different countries have different restrictions, and sometimes restrictions can really protect us, but sometimes they can impair us from doing our jobs, like you just said. And the future may need a lot more workforce to deal with these restrictions, like you said, restrictions that are supposed to protect us from burnout. So regarding burnout, what advice would you give to a starting physician to say, this is how, these are some strategies that can help you prevent burnout? And don't look at your emails every second of the day, for instance. Go running once or twice a week, have some physical activity, something like that. What would your advice be?
Yeah, well, those are also very good actions, right? And I try to keep my work at work, right? So if I go home, if it's 6 o'clock or 7 o'clock, but when I go home, I try not to work at home. Try to do everything within my working day. When I'm at home, I'm at home, and I'm the private person. The second I would recommend, especially for young colleagues, find a mentor. Find a mentor, find a colleague, not even a urology colleague, but also a surgery colleague or an internal medicine colleague, who would be a objective judge on how you work, how your balance is. Because sometimes you just need somebody else to tell you work too hard, or let's go home. Don't try to say no sometimes. So I think that a mentor is good. Don't digitalize yourself. Don't go to your emails. Don't go to your phone every second of the day. Because we're in a 24-hour business, right? So the patients, that they're not. It's not that the patients stop coming to the hospital at 6 o'clock. No, but try to detach yourself from those kind of digital ways to monitor the patient, and try to find relaxation outside your job, either whatever makes you tick, right? Sports or theater or language courses or whatever you want to do, and try to be the good family man or woman you can.
Oh, thank you very much. Very, very good advice. And if I can summarize, finding a work-life balance is a very personal thing. Job satisfaction is definitely an important part to keep you active and happy in your work. But it's also important to have boundaries about your work. Make sure that at work you're at work, but you have boundaries that when you're not at work, the time is for you. If you don't care for yourself, you can't care for others. So self-care is really important. Find hobbies. And I think a very important piece of advice that you gave there is find a mentor that has experienced it all already and may identify that when you're going over the threshold before you identify it yourself. Thank you very much for that advice. That's great. Thank you.
Okay, you're welcome.
Thanks.
Thank you for this insightful episode. We are sure our listeners enjoyed it. Stay tuned for our next episode, where we'll be exploring academic clinics balance and how to achieve it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.